Hi, I'm Joan Justice of HealthWorks Collective, and I'm here with Casey Quinlan, founder and CEO of Mighty Casey Media and author of Cancer for Christmas, speaker, activist, and cancer survivor. Casey has some definite ideas on how to reduce healthcare costs and maintain patient satisfaction, so I'm just going to let her talk.
Hi, Joan. Thanks for the opportunity. The first thing I want to bring up is the really big question in healthcare. Do you know what the really big question in healthcare is? Have you ever heard it? It's called, how much is that? No one ever asked that question. How nuts is it that the biggest consumer-facing industry in the United States, one that touches every single human being in our country and in every other country around the planet, healthcare, has no pricing transparency in this country. If you go into a doctor's office or into a testing facility or into a hospital and say, how much is that? They look at you like, I have no idea. And that's not a great way to run a railroad or a hospital or a medical practice or a testing facility or your life. So I encourage people to think in terms of their own pocketbooks when they're making healthcare purchases, because it is a purchase. Now, granted, I will say right away that if you get hit by a bus and wind up in the ER, that is not the first place to say how much is that, because you'll likely be out cold anyway, so you won't know to ask. But in your usual path and passage through the healthcare system, which I liken to a car wash, by the way, and when you go to the car wash, number one, you know how much it is, and number two, you stay inside the car. Now, if you don't know how much it is and you get strapped to the hood, you can think about how that would work out for you. Lots of soap and wax up the nose, and those whirly towel things, they gotta hurt. They gotta hurt. So asking how much things cost will drive down the overall cost of healthcare, because it will encourage the doctors, hospitals, testing facilities, etc., labs, pick one, to actually know what the cost is. And it will also encourage them to share that information with us. Now, adding complexity to this issue is the fact that healthcare costs are related to insurance. Now, imagine, if you will, you go into a supermarket and you go aisles and aisles and aisles of food, everything you ever needed, and you have your list, but not a single thing in that store has a price on it. So you go up to the meat counter and you say, well, how much is that package of chicken breasts? And the guy says, well, I don't know. It depends. How you paying for it? Well, that's healthcare. You ask a question, how much is that? And the answer will currently, for the most part, be it depends. How are you paying for it? So now, I will encourage anyone who is watching this to, once they've finished watching it, go Google search on the LA Times for an article that was on their business pages May 27th of this year about a woman who needed, I believe it was an MRI after colon surgery. The MRI itself was somewhere in the neighborhood of $6,000 and change was what her insurance company was billed. Her portion of that was somewhere over $2,000, and she found out only after all of this had happened that if she'd asked what the cash price for it would be, it was like $1,500 total, which was less than her copay and way less than what her insurance company was billed. A lot of the pricing that exists right now in healthcare, if you ask, will be based on the fact that they're going to have this giant wad of paper that they're going to have to fill out, and forms back and forth and online and approvals and referrals and codes, and if anything's sideways, it all comes kicking back at them and they have to put it in again. The administrative costs alone are huge. But if you remove all of that and just say, how much is that I'm paying cash, which I know very well as someone who doesn't have insurance and pays cash for everything that I buy in healthcare, how much is that I'm paying cash? And I will only deal with companies and doctors and et cetera that can answer that question. Mm-hmm. Mm-hmm. So how much is that? That's the question. Start there. We'll fix the whole system.
Excellent. Excellent. So that's your recommendation. That's wonderful. Thank you so much. I can see a starting trend here. And the more we talk about how to reduce costs in healthcare, the more the word will get out. Right. Thanks so much for this, Casey.
Thank you, Joan.